All right, I'm going to be doing checkoff number 4. Hi, my name is Megan. I'm going to be doing an abdominal and renal assessment on you today, and then after that we're going to go into a neurological and musculoskeletal assessment. If at any point during the assessment you feel any pain or discomfort, just let me know and we'll stop. Okay, so I'm going to start off by observing the contour and symmetry of your abdomen. I'm going to be checking for your skin, any scars, anything like that. I'm going to get at eye level. I'm going to observe for vibrations or pulsations. Normally my patient would be in a gown, he wouldn't be fully clothed, or he wouldn't have a shirt on, so I can inspect his skin. From there I'm going to go into listening to your abdomen. I'm going to check your bowel sounds. Okay, from here I'm going to flip my stethoscope over and listen with the bell. I'm going to check your vascular sounds. I'm starting with the aorta, going down into the renal, the iliac, and the femoral. And then back up to the aorta. Okay, next I'm going to be percussing your abdomen. If you experience any pain, let me know. Alright, next I'm going to be palpating your abdomen. I'm going to start off with some light palpation. I'm going to be checking all 4 quadrants. I'm not tickling you. Okay, I'm doing deep palpation. Okay, and next I'm going to be palpating your liver. I'm going to put my hand underneath you. And what I want you to do is take a deep breath. Okay, and exhale. Okay, good. Next I'm going to palpate your spleen. Same thing, I need you to take a deep breath. And exhale. Good. Alright, now I'm going to be palpating your spleen. Alright, next I'm going to be finding your liver span. I would measure and mark the areas at the top of the liver and the bottom of the liver. Span should be between 5 and 10 centimeters. Alright, next I would palpate the femoral artery and then the inguinal lymph nodes, and I would be checking for any swelling or enlargement, also any pain or tenderness when I did so. Alright, next we're going to go into our Murphy sign. I'm going to be checking for gallstones. What I want you to do is I'm going to push into you. I want you to take a deep breath. Exhale. Okay, good. Checking for referred pain with the Robson sign. Do you have any pain when I do that? How about when I do that? No? No pain? Alright. Alright, now I'm checking for the Iliopsoas sign, the psoas sign. I'm going to put my hand on your thigh. I need you to lift your leg into your abdomen. Do you have any abdominal pain when I do that? On the other side? No? Okay. Alright, good. Alright. Next, what I need you to do is we're going to be checking your musculoskeletal system. We're going to start again by, I'm going to observe your upper and lower extremities. I'm going to check for hair distribution, check for skin color. Again, the client wouldn't be clothed. Symmetry, make sure you don't have one limb longer than the other. I'll be checking your pulses. I'm going to start with the femoral pulse. I'm going to go down into the popliteal. And then the posterior tibial. Posterior tibial. Checking the inside of the foot. And then the dorsalis pedis pulse. And I would do the same thing on the other side. Okay. All right, next I'm going to check the range of motion on your lower extremities. I'm going to have you start by lifting one leg at a time into the air, up as far as you can, and back down, and the other leg. Okay. All right, now I need you to bend your knee into your abdomen, and put your foot down, and then roll your knee inwards, and extend your leg back out. And then the same thing on this side, knee into your chest, put your foot down, and roll it in. Okay, extend your legs back out. All right, now what I want you to do is I want you to turn your ankle inwards and back out. All right, and the other one, in and then out. I need you to span out your toes. Okay, good, and then roll your toes into a ball. Okay, good. All right, now I need you to fan your knees out like you're making a snow angel. And back. All right, I want you to do it one more time, but I'm going to apply some resistance, okay? Go ahead. All right, good, and back. Okay, now I need you to bring your knee into your chest one more time, but I'm going to be doing it with my hand on your thigh, okay? Okay, good. And the other one. Okay, good. All right, now we're going to be checking your range of motion for your upper extremities. Can I have you go into a sitting position, please? All right, now what I need you to do, I'm going to put my hands on your shoulders. You just shrug your shoulders up. Okay, good. Now I need you to lift your hands all the way into the air and touch your palms together. All right, now lay them all the way back. Extend them back if you can. Place them behind your back, the small of your back. Good, and behind your head. All right, good. Now lay them at your side. I need you to cross one arm in front of your body. And the other side. Okay, good. Now I need you to take your hand and then bring it up into your elbow. Okay, good. And back down. And the other side. Okay, now I want you to lay your hands out straight. I want you to turn them on their side, flip them over with your palms up, and then roll them back down with your palms down. Okay, now I need you to move your wrist in and out. Okay, good. Can you span your fingers out for me? And put them back. And do that one more time. Okay, good. Now I need you to raise your hand. And what I want you to do is I want you to straighten your arm, okay? All right, and the other side. All right, good. All right, while I have you in this position, I'm going to go ahead and check your kidneys. I'm going to do percussion of these kidneys. Can you turn towards me? A little bit more. Have any pain? No? Okay. All right, good. Okay, next we're going to do our heel-to-toe assessment. We're going to be checking for equilibrium, and then we're going to be doing and checking for scoliosis. Okay, so what I want you to do at this time is I need you to stand up. And I'm going to walk alongside of you. And what I want you to do is I want you to put your heel to your toe and then walk in a straight line. Okay, good, good, good. All right, now I need you to come back this way. And what I'm going to do is I'm going to have you bend over and touch your toes. And I'm going to be checking the curvature of his spine. Okay, you can stand up. All right. Thank you.
Thank you.
Okay. To document my assessment, I would document that the contour of the abdomen is flat, the umbilicus is free of inflammation and drainage, the skin is smooth and moist and free of any lesions or striae, or there's no masses, there's no lumps or bumps or bruises. He does have a scar from an appendix removal that is healed. There's no abnormal pigmentation. Both sides of the abdomen were symmetrical. The contour was even. The shape and the contour was symmetrical on both sides. During, there was no vibrations or pulsations or anything like that. During auscultation, I noted bowel sounds in all 4 quadrants. There was no pain or tenderness. His vascular sounds were present and regular. During percussion, I heard tympany and resonance when I palpated the spleen. I could not feel the spleen when I palpated. The liver was smooth and round, and again, there was no pain during palpation of the liver. The liver wasn't enlarged or anything either. The liver was also firm. When I palpated, his vascular sounds were present, regular, I said that. He didn't have any abdominal pain during my psoas sign, my Murphy sign, and then, the Murphy sign when I checked the gallbladder, also no pain was noted, and there was no referred pain. When I did his range of motion on his upper and lower extremities, again, I looked at his skin. His upper and lower extremities were equal. The skin didn't have any abnormalities. There was no skin. Hair distribution was even. No scars. They were the same length and symmetrical on both sides. He had full range of motion in both upper and lower extremities. There was no pain, and his muscle strength on a scale of 0 to 5 was a 5, again in both upper and lower extremities. I did not note any scoliosis. There was no abnormal curvation of the spine. And then I performed the Romberg's test, and he did that. That was to check for cranial nerve number 8, and he had good equilibrium and there was no swaying. Thank you.